Hi, everybody. We're nursing students at the College of New Jersey, and we want to discuss hypertension today. So at the end of this presentation, the learner will be able to list and describe at least 3 lifestyle modifications for managing and preventing hypertension, identify 3 risk factors for hypertension, and you will be able to define the different classifications based on different blood pressure levels. So going into what is blood pressure. So imagine your blood is water, right? And you're going to think of your blood as water flowing through a garden hose. Your heart is the pump. Your heart is like the water pump pushing the water, aka the blood, through the hose, which is we're referring to as the blood vessels. And then to pushing the heart, so your blood pressure is like how hard the pump has to push to get the water to move through the hose. Sometimes the hose is wide and the water can flow easily, and sometimes it's narrow, making it harder for the water to get through. So understanding the numbers when it comes to blood pressure. The blood pressure always comes with 2 numbers. It's measured with a systolic and a diastolic pressure. An example of this is 120/80. So the first number, being a systolic pressure, is how hard the heart is pushing when it's working at its hardest. The second number, which is the diastolic pressure, is how hard the blood is pressing against the walls of the blood vessels when the heart is resting between contractions. So what is hypertension? So it's also known as high blood pressure. This is a common condition that affects the body's arteries. High blood pressure indicates that the force of your blood pushing against the walls of your arteries is consistently too high. This causes the heart to work harder. So in general, hypertension is classified as a systolic reading, the top number, over 130, and a diastolic reading, the bottom number, over 80. And there are different stages of hypertension. So a normal blood pressure is 120/80 or a little bit lower. Elevated blood pressure is when you have your systolic or your top number being between 120 and 129, and the bottom number is below but not above 80. And within stage 1 hypertension, you have your systolic, again, the top number between 130 and 139, and then your bottom number or the diastolic number between 80 and 89. Stage 2 hypertension is, again, where you have a blood pressure reading of 140 or higher, or the bottom number is 90 or higher. But one thing you should definitely know is if you ever have a blood pressure reading of 180 over 120 or greater, this is considered a medical emergency, and it's important that you seek medical attention, as it might lead to some adverse events, which we'll also go over in the presentation as well.
So hypertension is significant. It's a really important disease that a lot of people should know about. So it actually over 1.2 billion people worldwide are afflicted with hypertension, and that's a large portion of the people in the world. It's actually commonly deemed the silent killer by healthcare professionals. Imagine that. It sounds ominous. And the reason for that is because many cases of hypertension remain undetected. And you know what? Hypertension, it's dangerous for like a lot of different reasons. It can lead to different things like chest pain or angina, heart failure, irregular heartbeats, which can be potentially fatal, and even stroke. Those are scary things. In addition to complications from the disease itself, so hypertension can put you at a greater risk for like other diseases. And these other diseases are also really bad. And they include kidney disease, eye damage, coronary artery disease, and vascular dementia. So it's like it's scary stuff. It's serious. And now who does it affect? It's widespread. You imagine like 1.2 billion, that's a lot of people. But it's a widespread disease, and many people are at risk for developing the condition. But still, there's like certain groups of people that are at even a greater risk for developing it. And that includes people who are over the age of 55, African Americans, people who are overweight or obese, smokers or tobacco users, and people who are like heavy drinkers, people that drink a lot of alcoholic beverages, And even people that are afflicted by certain medical complications like obstructive sleep apnea, thyroid disease, and or chronic kidney disease, because people can have different mixes of diseases like that. So like particularly like being over the age of 55 puts you at a higher risk. So it's something that you should really look out for.
There are certain barriers to hypertension, so it is very important to consider those barriers because it may impede your ability and readiness to learn about hypertension. These can include literacy barriers, which is when a patient has the limited ability to read, write, and understand health information, language barriers, and cultural barriers, which can pose challenges to effective communication between a provider and you. Physical barriers, such as limited mobility due to complications or other illnesses that may impact hypertension, as well as your lifestyle choices, such as diet, exercise, and smoking. And finally, environmental barriers, such as transportation issues that can make it difficult to access healthcare facilities. In order to address these strategies, you can receive simplified materials, have visual aids, have interactive techniques, and your provider may incorporate teach back methods as well. For language barriers, you may receive a qualified translator who can also be bilingual or receive culturally appropriate materials. That also goes along with cultural barriers, which can also include cultural competence training, engage with the community leaders, receive personalized care plans, and have communication styles that complement your provider. Physical barriers also can include accessible facilities, receiving assistive devices, and pain management regarding your hypertension. Environmental barriers, in order to tackle that, it would be helpful to minimize distractions and have a comfortable setting.
So there are a lot of ways that you can prevent yourself from getting hypertension. So it can be dietary things such as eating more fruits and vegetables, keeping up with your appointments with your healthcare provider, taking all prescribed medications, trying to stand up as much as you can, do not remain sitting for long periods of time. Try to be more physically active, getting at least 150 minutes per week of moderate intensity exercise or 75 minutes per week of more vigorous aerobic activity. You can also do strength building exercises and as well lose weight if you are overweight or obese.
So for hypertension, there are modifiable risk factors and non-modifiable risk factors. So modifiable risk factors can be changed. So these include being overweight or obese, not being physically active, like we talked about in the last slide, eating a high salt diet, and having a high alcohol intake. These can all contribute to hypertension. The non-modifiable risk factors, like I said, cannot be changed. So this includes a family history of hypertension, your age, so being over 65 years old puts you at risk of hypertension,
genetics, and then coexisting diseases such as diabetes or kidney disease. There are many symptoms of hypertension. Symptoms include severe headaches, chest pain, difficulty breathing, blurred vision, anxiety, a buzzing in the ears, and abnormal heart rhythm. If you have any of these symptoms, contact your doctor. And then there are some adverse effects of hypertension. So one of them is a hypertensive crisis. So this includes a severe and sudden headache, severe and sudden chest pains, blurry vision, and shortness of breath. Hypertension can lead to stroke, as hypertension contributes to 50% of all strokes. Dementia, because hypertension causes blocked arteries, which leads to decreased blood flow in the brain. And lastly, kidney disease. 1 in 5 people with hypertension are diagnosed with kidney disease. So preventing hypertension is important for preventing other illnesses.
So there are some treatments, ways to bring down your blood pressure. So obviously there's medication, which you can go to your primary care provider and be prescribed a medication. But you can also make lifestyle changes such as eating healthy, specifically a low salt diet, quitting tobacco, losing weight, or being physically active. Like I said, if you do have high blood pressure, your provider may recommend medication, and it is important to adhere to their recommendations. As well, blood pressure under 130/80 is the goal for people who have diabetes, cardiovascular disease, chronic kidney disease, or are at a high risk of cardiovascular disease. So that is it. If you have any questions about hypertension, you can reach out to your primary care provider or even reach out to us, students at TCNJ. We can include our emails in this.